the topic for today's discussion is microabscess, which you see in pathology. So by now you will have discussed what I'm going to talk about. So first image is this. So the first microabscess which I'm going to talk about is this. Okay, so any guess what is this microabscess? So what do you mean by a microabscess? So it's a small collection of neutrophils. So it need not be always neutrophils. It could be lymphocytes or dead cells. So it's a small collection of neutrophils, lymphocytes or any dead cells. That's what we call it as a microabscess. So this is from the skin and there is a circle around the microabscess. Any guess what is this microabscess? So let me show the clinical picture. So that was a skin biopsy from a patient who presented with scaly lesions in the skin, silvery scales. So this is typical of psoriasis. So what type of microabscess can you get in psoriasis? So the abscess which you get in psoriasis is called Monro microabscess. It's called Monro microabscess. So what is Monro microabscess? So you will have collection of neutrophils in the stratum corneum. So in the skin you have different layers. The topmost layer is the stratum corneum. The bottom layer is stratum basale. In between you have other layers, your stratum granulosum, your spinosum and other layers. So if you have collection of neutrophils in the epidermis, especially in the stratum corneum, we call this as a Monro microabscess. So remember, Monro microabscess is seen in psoriasis. Okay. So the next microabscess is again in the skin. So here you have the epidermis. So here you have collection of cells, but this is not neutrophils. These are small cells, round cells. These are lymphocytes. So what do you call it as? They are not normal lymphocytes. They are atypical lymphocyte. So these collection of atypical lymphocytes in the epidermis. So let me show the clinical picture of this patient. It's an old-aged male who presented with these erythematous plaques in the skin all over the abdomen. Now we'll go back to the image. What's your diagnosis? You have in the epidermis a small collection of neutrophils. So with this background of erythematous lesions, okay, what can you call this as? It's a malignancy. It's a type of cutaneous T-cell lymphoma. Now any clue what is this abscess, what I'm talking about? So the abscess here which I'm talking about is called Portreous microabscess. So Portreous microabscess is seen in a type of cutaneous T-cell lymphoma called mycosis fungoides. It is seen in mycosis fungoides. Okay, so these are microabscess which you get to see in certain dermatological conditions. Okay, so we have discussed two types of microabscess. One is Monro microabscess, which you see in psoriasis. The other one is Portreous microabscess, which you see in your mycosis fungoides. Do you know any other microabscess? So if you read Robbins, the infection chapter, you can see stellate microabscess. So stellate microabscess can be caused by LGV. That's called lymphogranuloma venereum. What's the causative organism? So the causative organism for lymphogranuloma venereum is Chlamydia trachomatis. So now you must be wondering about one disease because I mentioned about stellate. So remember, stellate microabscess is seen in LGV, but sometimes you can get something called a stellate granuloma. So what do you mean by a stellate granuloma? So stellate means star shape. So you can get something called stellate granuloma in cat scratch disease. So cat scratch disease is caused by Bartonella Hensley. It's caused by Bartonella Hensley. Okay, so this again is an important question. So you can get microabscess in cat scratch disease, but do remember that you can get it in LGV also. So this is about the different types of microabscesses. So thank you for your patient listening. So you can subscribe to the channel for more interesting videos like this. Thank you.